Remember, over the last 3 days, there's been a heightened alert. The Health Ministry has first written to all state governments to ramp up their genome sequencing, because keeping tab on the variants prevalent in the community and their spread is very, very important. And then, of course, testing, tracking, all of these are the 5 T's that the government has been talking about are extremely important in this fight. The Health Minister has been chairing many meetings. These are pictures of the ministry meeting amidst the COVID concern that is currently taking place. My colleague Shireen is also joining us with more on this. Shireen, what's on the agenda particularly today? All right, we'll go across to Shireen in just a bit, but these are first images that are coming in of the Health Ministry meeting. This is a ministry meeting that is being held with all states. A lot of the other states also, remember, over the last 2 days have held their own review meetings. These include states like Tamil Nadu, Delhi, Punjab, Madhya Pradesh, Gujarat, and others. So a lot of states are actually looking at their preparedness. 3-4 things that the Prime Minister also talked about as far as his COVID meeting yesterday is concerned is that there should be no laxity as far as precautions are concerned. The precautionary booster dose for all concerned, particularly the vulnerable and the aged, must be boosted. In fact, there's already an uptick as far as the booster doses are concerned. People are obviously responding to the reports that are emerging and now queuing up to get their precautionary dose. My colleague Shireen is also joining us with more on this. Shireen, just give us a sense of what the Health Ministry might be urging today or discussing with the state governments.
Well, a basic advisory, in fact, will be given to all the state health ministry, all the state health ministers, and accordingly, each state will in fact be gauging the situation on ground in their states, and accordingly, they will be planning what more mandatory or whether a strict guideline need to be issued in each of these states. Apart from that, a mock drill, in fact, has been planned by the health ministry, and all states, in fact, has been asked that on Tuesday, they have to conduct this particular mock drill in each of the health centers and hospitals to ensure that we are well prepared to face any sort of situation in case it goes out of hand. Those situations should be faced bravely, and that is why a mock drill has in fact been planned on Tuesday by the health ministry. So all these are the agenda of the meeting. Apart from that, the health ministry also will be asking the state health ministers to ensure that the precaution dose we are seeing that in fact it is picking up, but more and more people need to come out and take precaution dose is what something that will be advised to all the states of this time.
All right. In the last couple of days, Shireen, already the states have been asked to ramp up their genome sequencing. Every positive sample is to be sent from them, or a genome sequencing has to be done on that. How prepared are the facilities in India to handle that kind of a load? And this mock drill that you talk about, just give us a few more details on that.
Well, there is in fact a separate meeting of the InfoGov, which is in fact a multidisciplinary genome sequencing lab across the country. There are about 10 labs, central labs, which does genome sequencing, and 30 regional labs. Now, in all of these states, there are in fact each genome sequencing lab. In case, depending on the situation in their state, each state will be advised wherever they can send. Of course, they can send to NIB, Pune lab. Apart from that, they have each of these regional labs in their own state. But at the end of the day, they have to ensure that each of such positive samples are in fact sent to genome sequencing lab, because that is the only way to determine whether there is in fact a new variant or not. And as far as the mock drill is concerned, mock drill is in fact a first time initiative that has been taken by the health ministry. We have not seen something like this either in the first wave or the second wave, but this time they want to be very well prepared, and that is why in this particular mock drill, what they are going to do is that they are going to pretend that a patient has in fact entered the hospital who's COVID positive. Accordingly, he or she, whether she needs or he needs an ICU, ventilator, the beds, what are the availability, the oxygen plant, how it is working in each of these hospitals, that will be checked, that will be gauged whether we are well prepared enough or not. So that is going to begin on Tuesday, and the Union Health Minister himself will be present in one of such hospitals in Delhi.
Okay. The other thing that is coming to light, Shireen, is that as far as this variant is concerned, it has existed in India since July. All of the 4 cases that were confirmed of this BF.7 variant, which is linked to the surge in China especially, have recovered and they're doing fine. and in many other countries too, this variant has been found for the last 2 years. So what are experts saying, or what kind of damage this variant can do in India now?
Well, Shivani, the experts have in fact been saying that in each country, the disease dynamic, the communicable disease dynamic is different. When it comes to India, we have seen first wave, we have seen second wave. We have natural immunity. Our vaccination coverage has in fact been very good. We have 4 cases of BF7, like you mentioned, has in fact been detected in the month of September and October. But these 4 patients who have in fact been detected with BF7 have recovered very fast. Meanwhile, the same variant is creating havoc in China. So it is, in fact, the dynamics are very different from country to country. In China, we have seen so far they had, and now when things are opening up and with their vaccine coverage, they first inoculated the younger population and then the elderly population. So that is, of course, backfiring them, is what the experts have been saying. And that is why BF7 is creating a havoc there. But the situation as of now in India is very different. You know that it is only 0.1% COVID positivity rate that India is facing. So the situation is much better than any country at this point.
All right.